everyone. My name is Javier Cardona. Today I'm in Bogota, Colombia. We're building world-class primary care for Spanish-speaking Latin America. Let me give you some context before about Latin America. The problem is that in Latin America, access to healthcare is so difficult. It will take you from a day to a week to just talk to a general physician. And for most people, it is really expensive. The other problem we experience is that only 5% of the population are able to afford any kind of private insurance. So the other 95%, they just have to deal with whatever is available in their countries. And this was even pre-COVID. So we are in a very tough scenario for people to access primary care in the region, in the entire region. So at 1Doc3's, we're building affordable, high quality primary care for all and in seconds. We believe everyone should be able to talk to a doctor without waiting days. So with our platform, you can just pick up your phone and talk to a doctor right away. It is really easy and simple to use. You just type in what your consultation is about, then some symptom assessment AI that we build triggers some questions about yourself, about your symptoms, while collecting all this information, what is happening before we're gonna connect you to a doctor without even having an appointment. It's just on the other side of the platform, doctors will receive an AI-assisted triage, pre-diagnosis, and even ICD-10 classifications. So the impact of the technology at this point is basically saving doctors time so we're able to serve more people and in a very affordable way. So then when we get you connected to the doctor already knows what is going on, what are your symptoms, and even what types of diagnosis could be done, right? So you just get to talk to the doctor. You can even upgrade your session to a video consultation. And then, well, basically pre-pandemic, we were doing around 5,000 consultations. Then by the end of March, for April, when the pandemic hit in our region, we started growing like crazy, 3 times, 4 times. Today, we're doing almost 7 times the number of consultations we were doing, just proving that the technology is the key to be able to provide this level of consultations to actually be able to scale. Our revenue is also growing too. Today, we are sitting on 90K monthly recurring revenue and keep growing at around 19% month over month with a 71% gross margin. This is very important, the gross margin, because it's also enabled by the technology we are building. The business model is really simple. We work with payers. We work with health insurance companies. Basically, we are the first layer of care, of primary care for their customers. We work with more than 7 big health insurance companies in the region. We also have an enterprise product where basically companies provide our product as a benefit for their employees. Basically, they keep them safe, but also they can access a doctor anytime they want. We also have a small B2C part where anyone could go to our platform and get an on-demand consultation with our doctors. We have a great team with the right set of skills, from developers to doctors to mathematicians, building this technology, but not only the technology, but also the perfect integration with the general physicians to be able to provide consultations at this scale. More than 500 doctors are active every month on our network providing consultations. For us, it's not just the pandemic. The future is we're just 1% into our trip. What we're doing now is accelerating. We keep on working on replicating this model. First, we were out of Colombia. Now we have operations in a couple of countries in Latin America, like Mexico and Peru. We keep on building the product. We are creating this primary care ecosystem where it's not only the consultation, but also be able to provide medications, lab tests, so on and so forth, and also be able to integrate the online to the offline world, where we can solve almost any problem. For us, the future is bright. We are going from 220,000 consultations in 2020 to 1 million this year, from 1 million in ARR to 3 million in this year, and also improving a lot our accuracy in the platform, which is translated into big savings. If you want to learn more about the opportunities that we have in Latin America, just talk to me, no matter if you're a potential partner or investor. We want to meet you all. We need you in Latin America. Thank you.
Awesome. What a year it's been for you and your team, Javier. Awesome. Logan has a question. Can you come off mute and ask your question, Logan?
Yeah, absolutely. Yeah, Javier, awesome to see your numbers, just to see what you've done this past year. Could you give us a sense of the broader telemedicine landscape there in Colombia where you are, but also just Latin America in general?
Well, that is a great question. I mean, 95% of our consultations are done on text. It's real time, but are chat sessions. So just to answer your question, the landscape at the beginning, it was a lot of video calling services with doctors. But the reality of our region is that we still have problems with the connectivity. We still have problems with the kind of handsets people have. So a video call could be a very bad experience for the 95% of the people that are not able to afford private insurance and a big or a nice iPhone 11. So our approach is a little bit different. It's not just video consulting with a doctor. It's about allowing anyone to talk to a doctor in seconds. And we found that the chat experience, which WhatsApp taught us all in Latin America, is the way to go. And that's why probably we're the largest provider in the region.
Question from Andy Geist. Andy, you want to come off mute and ask your question from Health Tech Capital?
Yes, Javier, nice presentation. Are you a US-based corporation? Where are you physically located as a legal entity?
Yes, we are a C Corp in Delaware. We have operations in Colombia, in Mexico, and Peru.
Okay, and do you have investors from the US right now, or who is on the board?
Yes, we do have 3 investors from the US and another 3 from the Latin American region.
Okay, I'll send you a private email. Thanks.
Awesome.
And if I could just add one little note. I first met Javier, if you recall, in Argentina a few years ago now. So that was back when several years ago when you were just getting started, and it's been really awesome to see your progress year after year, and you're so modest, but you really are the leading, if not, or one of the leading virtual care platforms in the whole Latin American region now. So congratulations on everything that you're continuing to do.